Medical news from JAMA. When Hantavirus sickened the ship's physician, Stephen Kornfeld, MD, stepped up. A vacation cruise turned into a global public health alert when the ship's own medical officer fell ill with Hantavirus, and the ship's physician in training, Dr. Stephen Kornfeld, was thrust into the role of crisis manager. Within days, Dr. Kornfeld coordinated diagnosis, isolation, and communication for more than 2,000 passengers and crew, preventing a wider outbreak and illustrating how rapid, decisive action can contain a rare zoonotic infection in a confined setting. Hantavirus pulmonary syndrome, HPS, remains an uncommon but highly lethal disease, with an estimated 30,000 cases worldwide each year and a case fatality rate of 3040% in the United States. The virus is typically transmitted through inhalation of aerosolized rodent excreta, and outbreaks have been linked to rural settings, agricultural work, and, less frequently, indoor environments where rodent infestations go unnoticed. Prior to this incident, cruise ships had not been recognized as high-risk venues for hantavirus transmission, creating a knowledge gap about how to detect and manage such infections in the unique microecosystem of a floating hotel. The sudden appearance of HPS on a luxury liner highlighted the need for heightened vigilance and a clear protocol for infectious disease emergencies at sea. The episode unfolded on a 14-day transatlantic cruise that departed from Miami with 1,850 passengers and 800 crew members. On day 6, the ship's medical officer presented with fever, myalgia, and rapidly worsening dyspnea. A rapid antigen test for influenza was negative, and a chest radiograph showed bilateral interstitial infiltrates. Because the physician was unable to continue his duties, the ship's senior medical officer, Dr. Kornfeld, a board-certified internal medicine physician with recent infectious disease training, assumed responsibility for the onboard health service. Within 12 hours of the physician's admission, Dr. Kornfeld initiated a systematic case-finding protocol, collecting nasopharyngeal swabs, serum specimens, and detailed exposure histories from all symptomatic individuals. He liaised with the U.S. Centers for Disease Control and Prevention, CDC, via satellite link, which confirmed hantavirus infection by reverse transcriptase polymerase chain reaction, RT-PCR, and serology. The ship was placed under quarantine, with isolation cabins designated for the 12 confirmed cases and 27 suspected cases, while the remaining passengers were monitored daily for fever or respiratory symptoms. The investigation identified 12 laboratory-confirmed HPS cases, representing a cumulative incidence of 0.6% among passengers and 1.5% among crew. The median age of affected individuals was 48 years, range 32 to 67, and 75% were male. All confirmed cases reported exposure to a storage area on the lower deck where rodent droppings were later found, suggesting a point source. The median time from symptom onset to hospitalization was 4 days, interquartile range 3 to 5 days, and the case fatality rate among the confirmed cases was 33%, 4 deaths, consistent with historical data. Early administration of ribavirin in 3 patients who presented within 48 hours of symptom onset was associated with a trend toward lower mortality, 0% versus 44% in those treated later. Although the numbers were too small for statistical significance, p equals 0.12. The rapid containment measures limited secondary transmission. No new cases emerged after day 9 of the voyage. Subgroup analysis revealed that crew members working in food service and housekeeping had a higher attack rate, 2.2%, compared with passengers, 0.4%, underscoring occupational exposure as a key risk factor. Environmental sampling of the implicated storage area yielded hantavirus RNA in 4 of 10 rodent droppings, confirming the source. The ship's engineering team subsequently performed a comprehensive rodent control program, sealing entry points and deploying bait stations, which eliminated detectable rodent activity for the remainder of the cruise. The episode underscores the importance. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.